In this new millennium, we've already come to a crossroads. We're increasingly bombarded by toxins in our environment. We live in an era of the supervirus, of multiple disease-resistant microbes, and of course the ever-present common cold. And yet, in the last 2 decades alone, we've been granted gifts of some of the most significant discoveries in the history of modern science and health technology, to help us build and sustain our immune system in a conscious and deliberate way, and live longer lives at optimum health, energy, and vitality. And science has always been challenged as to how to naturally reinforce our immune systems. But for the true scientific visionary, challenges form the doorways to discovery. And having the knowledge that there is an untapped element, a key ingredient waiting to be discovered, only spurs innovation. That untapped element comes in the form of a small, naturally occurring molecule called glutathione.
Science has known about glutathione probably for over 100 years. It's just that until recently we haven't had a good way of raising glutathione levels safely and naturally. Now, we have drugs that raise glutathione, but just like so many other drugs, they have a lot of side effects. Things like N-acetylcysteine. Very often people that take it don't like the way they feel, nausea or vomiting. The other problem with most of these drugs is they have what's called a short half-life. In other words, after you take it, it hangs around for a few hours and then it's gone. In order to raise glutathione levels throughout the day, you'd have to take these medications 2, 3, or even 4 times a day. And if you felt sick the first time you took it, you're going to feel 4 times as sick the 4th time you take it. And when we're looking at something like Immunotec, we're talking about natural protein that has an effect sustained over the entire day without side effects. The main function of the immune system is to keep anything out of your body that's not supposed to be there. This anything we call an antigen. An antigen can be a virus, an antigen can be a bacteria, an antigen can be a fungus, an antigen can even be a tumor cell. Let's look at something as commonplace as a virus. See, when a virus gets into your bloodstream, one of the first things that'll happen is that our frontline soldiers of the immune system, something called a white blood cell, will see that this virus is there and try to do something about it. One of the things that the white blood cell might do is actually try to gobble up that virus. Now, the problem is we're not just talking about one virus. In 15 or 20 minutes, you might be flooded with hundreds and thousands, maybe millions of viruses, but you only have so many white blood cells. So the way that we fight off an infection is the white blood cells themselves will make clones called monoclonal expansion in an effort to overwhelm the enemy. Now, this is what Dr. Bunos pointed out so wonderfully and so eloquently 25 years ago, that there are many key factors that a white blood cell needs to perform its job. One of these critical elements is its supply of glutathione.
Swallowing glutathione will destroy it in the digestive system. And although 2 of the 3 amino acids that make up glutathione are easily available, the third, cysteine, is both rare and difficult to obtain in an absorbable form. It became clear that cysteine was the limiting factor in the human body's ability to produce glutathione. So finding an outside source of bioavailable cysteine would be the key that turned the lock.
Cysteine is an amino acid which is not only a precursor of proteins, but also a precursor of the small molecule glutathione. And other laboratories, including our laboratory at the National Cancer Research Center in Heidelberg, had shown already in the late 70s and early 80s that glutathione is very important for all kinds of physiological processes, and particularly for the functioning of the immune system. By the end of the 80s, of 1988, we even found that HIV-infected patients were strongly deficient in cysteine and glutathione, suggesting that that may actually be part of the reason why these patients are unfortunately so immunodeficient. And subsequently, in the late 90s, we found that seemingly healthy subjects, seemingly healthy persons, show declining levels of cysteine and glutathione in the course of aging, suggesting the possibility that this decline had an important role in aging.
Its dedication to cutting-edge health and nutritional products based primarily in immune health technology. That includes new immune-enhancing state-of-the-art products for anti-aging and antioxidant power, energy, detox, and peak performance. For baby boomers and seniors, performance athletes, for the entire family.
You can be sure that anything we develop at Immunotec is going to reach the highest validation for natural products. And in the future, people will be raising their glutathione levels as commonly as they take a multivitamin pill a day, as commonly as they brush their teeth every morning.
The leader of the immune segment of the wellness industry, and a company which is viewed as one of the most progressive, cutting-edge health technology companies in the world. And its name is Immunotec. It's been increasingly clear to scientists that the secrets to true health and longevity can usually be traced to the immune system. It was also long believed that there was virtually nothing that could be done to repair or rebuild the innate immune system set at birth in what amounted to a genetic roll of the dice. But it was later found that a second immune system, the adaptive immune system, was strongly affected by nutrition. Almost from the day we're born, the environment bombards our bodies and weakens our systems at a rate that practically amounts to either germ or chemical warfare. Air pollution, industrial spills and wastewater, dozens of diseases that may affect us from a food chain that is contaminated with steroids and antibiotics, pesticides and chemical fertilizers, the modern fast food junk food diet. Being overweight and all the complications that come with it now occurs in epidemic proportions. All of this brings challenges to the human immune system that we might never have imagined 100 years ago.